From Liverpool to Cardiff to London, up to 100,000 nurses across Britain have left their wards for the second time in a week amid a standoff with the government over pay and conditions.
We do as best as we can to keep our patients safe, but we need more staff to come in and help us.
Pay also has to be part of that negotiation process, and if he's not prepared to talk about pay, then the strikes will continue.
The pandemic put an additional strain on the country's already overstretched National Health Service. Then came the cost of living crisis, with inflation soaring above 10%, pushing healthcare workers to breaking point. After voting to stage industrial action for the first time in their 106-year history, the country's largest nursing union warned they won't back down, saying the government's offer of a 4% pay rise is not enough.
We want to be in caring for our patients, we want to be looking after our patients, but we need to have pay addressed. We need to have the 50,000 vacancies in this country addressed, and this is on the Prime Minister's shoulders, not the nursing staff.
The government insists it cannot afford a double-digit salary raise in the public sector, and that such a move would lead to prices surging even further.
I know things are difficult at the moment for people up and down the country with inflation. Of course I get that, but I think it's entirely right for me to stand here and say that we have treated everyone reasonably and fairly, and will continue to do that.
Authorities are warning people not to undertake any risky activity, as more than 10,000 ambulance drivers, paramedics and call handlers are set to join the strike on Wednesday. In response, the government has turned to the military for a backup, putting 600 drivers and 150 logistical staff on standby.